Okay, this is Dr. Paul Firnhaber, and it's time for another 10 minutes of truth. So today, I'm going to talk about a very important article that came out September of this year, which is just last month, in the Journal of Clinical Medicine. And I want you to understand that the Journal of Clinical Medicine is a very top-tier journal, hard to get into. And this was a randomized clinical trial, and it was featured as the feature paper in this issue. This study was, the primary author of this study was a chiropractor, and he had a few other PhDs working with him. So the name of the article is called, "Does Improvement Towards a Normal Cervical Sagittal Configuration Aid in the Management of Lumbosacral Radiculopathy? A randomized controlled trial." So that title is certainly a mouthful, and I'm going to explain what that means. So what this study did was they took 80 people that had confirmed disc prolapse at their L5 disc. The disc prolapse pressing on the sciatic nerve at the nerve root at the fifth lumbar vertebra, causing sciatic pain. And they all had this pain for at least 3 months. So 80 people with confirmed disc prolapse on MRI having sciatic pain for 3 months. They call that lumbar radiculopathy. And so the 80 people were divided into two groups. One group got the Denerol traction, which is just a device that you lay on that brings a curve back into your neck. Now, all groups were x-rayed, and they find out that every one of these people had a loss of their normal cervical curve. So what they wanted to find out in this article, in this study, is if you put the normal curve back into the neck, does it change the lumbar curve as well as the cervical curve? And does it change the pain running down somebody's leg? Does it change a radiculopathy? So the control group had hot packs and TENS unit. The study group had hot packs, TENS, and the Denerol. Remember, the Denerol is just a device that you lay on. I carry them here in my office that allows a head to come back and brings a curve back into the neck. So the people in this study the study lasted for 10 weeks. And all the people were x-rayed. They were x-rayed, their cervical curve was studied, their lumbar curve, whether there's any spinal curvature, pelvic inclination, forward head posture, meaning like when the head is forward like this, that was all measured. And at the end of 10 weeks, one of the things they found was that there were statistically significant differences in the groups. The people that laid on the Denerol had better posture, better cervical curve, better lumbar curve, less scoliosis in their spine, better pelvic tilt, and less forward head posture. Not only that, they found that at 10 weeks, these people had less pain, and they measured the neurophysiology of the sciatic nerve and found the sciatic nerve was actually working better. And all they did was put the curve back into the neck. So then they did a follow-up, a 6-month follow-up. And they said the analysis showed that there were still significant differences between the study and control groups for all the previous variables, all the x-ray findings, all the pain findings, all the neurophysiological findings of the sciatic nerve. They were all better in the study group. And so what this study shows is that abnormal posture of the neck, abnormal curve in the neck, and forward head posture can put stresses on the lumbar spine that can cause a prolapse or a herniated disc and pain down the leg. And if the only thing you do is fix the curve in the neck, you can actually change the curve in the lower back. Now, none of these people were even adjusted. They weren't given, chiropractic adjustments. They just laid on the Denerol. They started out 3 minutes a day and worked up to 20 minutes a day for 10 weeks. At the end of the study, the people that laid on the Denerol were far better than the control group. At the end of 6 months, they maintained the correction and they maintained the pain relief. So these are things that are done only in a chiropractic office. This study was done by a chiropractor who actually invented the Denerol to put the curve back in people's necks. And this is something that I do in my office on a regular basis. Put people on a Denerol, have them lay on it regularly. This brings a curve in the neck. It takes pressure off the spine. It relieves forward head posture. And over a 10-week period, it can actually make permanent changes in the spine. This is a great study, and it's the only study that's ever been done to link radiculopathy or sciatic pain in the lower back and leg with curvature in the neck. You change the curve in the neck, you can actually change the amount of pain going down somebody's leg. So that's all I have for you today. Again, we're doing our Patient Appreciation Week coming up in about 3 weeks, where we're going to be doing some spinal checks on patients, and we do these are complimentary. We do them at our expense. If you have friends and family that are suffering, maybe they're suffering needlessly, maybe we can help them. We can check them out. We'll do a subluxation check, see if they are good candidates for our office, see if we can help them, and maybe we can change their lives. So that's all I have. Hope you learned something from this study, and I'll see you again next week.